Childhood obesity. Childhood obesity is a genuine ailment that influences kids and teenagers. It's especially upsetting in light of the fact that the additional pounds regularly start kids on the way to medical conditions that were once viewed as grown-up issues: diabetes, hypertension, and elevated cholesterol. Childhood obesity can likewise prompt helpless confidence and discouragement. Probably the best system to decrease childhood obesity is to improve the eating and exercise propensities for your whole family. Treating and forestalling childhood obesity secures your kids' well-being now and later on. Side effects. Not all kids conveying additional pounds are overweight. A few kids have bigger than normal body outlines. Also, kids regularly convey various measures of muscle versus fat at the different phases of advancement. So you probably won't know by how your youngster looks if weight is a well-being concern. The weight record, BMI, which gives a rule of weight according to stature, is the acknowledged proportion of overweight and obesity. Your kid's PCP can utilize development outlines, the BMI, and, if essential, different tests to help you sort out if your kid's weight could present medical conditions. When to see a specialist. In case you're stressed that your kid is putting on a lot of weight, converse with their primary care physician. The specialist will think about your kid's set of experiences of development and improvement, your family's weight for stature history, and where your youngster lands on the development outlines. This can help decide whether your youngster's weight is in an undesirable reach. Causes. Way of life issues, too little movement and such a large number of calories from food and beverages, are the primary supporters of childhood obesity. Yet, hereditary and hormonal elements may assume a part also. Risk factors. Numerous components, typically working in mix, increment your youngster's danger of getting overweight. Diet. Routinely eating unhealthy food sources, like quick food sources, heated merchandise and candy machine snacks, can make your kid put on weight. Candy and treats likewise can cause weight gain, and then some in more proof focuses to sweet beverages, including organic product squeezes and sports drinks, as guilty parties in obesity in certain individuals. Absence of activity. Kids who don't practice much are bound to put on weight since they don't consume as numerous calories. An excessive amount of time spent in inactive exercises, for example, staring at the TV or playing computer games, additionally adds to the issue. Television programs likewise regularly highlight promotions for unfortunate food varieties. Family factors. In the event that your kid comes from a group of overweight individuals, the person in question might be bound to gain weight. This is particularly obvious in a climate where fatty food varieties are consistently accessible and actual work isn't supported. Mental elements. Individual, parental and family stress can build a kid's danger of obesity. A few kids gorge to adapt to issues or to manage feelings, like pressure, or to battle fatigue. Their folks may have comparable inclinations. Financial variables. Individuals in certain networks have restricted assets and restricted admittance to stores. Subsequently, they may purchase comfort food varieties that don't ruin rapidly, like frozen dinners, wafers and treats. Additionally, individuals who live in lower pay areas probably won't approach a protected spot to work out. Certain prescriptions. Some physician-endorsed medications can build the danger of creating obesity. They incorporate prednisone, lithium, amitriptyline, paroxetine, Paxil, gabapentin, Neurontin, Grelise, Horizont, and propranolol, Inderal, Hemangiol. Intricacies. Childhood obesity regularly causes complexities in a youngster's physical, social and enthusiastic prosperity. Actual difficulties. Actual difficulties of childhood obesity may include Type 2 diabetes. This ongoing condition influences the manner in which your youngster's body utilizes sugar, glucose. Obesity and an inactive way of life increment the danger of type 2 diabetes. Elevated cholesterol and hypertension. A less than stellar eating routine can make your youngster foster either of these conditions. These elements can add to the development of plaques in the corridors, which can make veins limit and solidify, perhaps prompting a cardiovascular failure or stroke further down the road. Joint agony. Additional weight causes additional weight on hips and knees. Childhood obesity can cause torment and at times wounds in the hips, knees and back. Breathing issues. Asthma is more normal in youngsters who are overweight. These kids are likewise bound to foster obstructive rest apnea, a possibly genuine issue where a kid's breathing over and again stops and starts during rest. Non-alcoholic greasy liver sickness, NAFLD. This issue, which generally causes no manifestations, makes greasy stores develop in the liver. NAFLD can prompt scarring and liver harm. Social and enthusiastic confusions. Youngsters who have obesity may encounter prodding or harassing by their friends. This can bring about a deficiency of confidence and an expanded danger of misery and nervousness. Anticipation. To help forestall overabundance weight acquire in your youngster, you can set a genuine model. Make smart dieting and ordinary actual work a family issue. Everybody will profit and nobody will feel singled out. Have sound snacks accessible. Alternatives incorporate air-popped popcorn without spread, organic products with low-fat yogurt, child carrots with hummus, or entire grain cereal with low-fat milk. Offer new food sources on various occasions. Try not to be debilitate if your kid doesn't quickly like another food. It for the most part takes various openings to a food to acquire acknowledgement. Pick non-food rewards. Promising candy for appropriate conduct is a poorly conceived notion. Be certain your kid gets sufficient rest. A few examinations demonstrate that too little rest may expand the danger of obesity. Lack of sleep can cause hormonal irregular characteristics that lead to expanded hunger. Additionally, be certain your youngster sees the specialist for well kid exams at any rate once per year. During this visit, the specialist estimates your kid's stature and weight and figures their BMI. A huge expansion in your youngster's BMI percentile rank more than 1 year might be a potential sign that your kid is in danger of getting overweight. Please remember to subscribe, like and share.